This is Aging Matters, care and comfort that surrounds you on FM 98.5 AM 680 WPTF. Joined by Mary Lucas from Transitions Life Care. Here's your host, Jason Kong.
Welcome to Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5 AM 680 WPTF. News, talk, traffic. Good afternoon to you. Jason Kong here with Mary Lucas and Sam Peterson representing Transitions Life Care. We've got a really great show lined up today, so I'm just going to do a roll call, make sure that everyone's here. Mary's here.
Present.
Sam, okay, very good. Now, to getting to the great stuff that we're very excited about today, we are very pleased and lucky to have on the line today Teepa Snow, founder of Positive Approach to Care, and that's an organization that advocates for and educates about dementia. Teepa, thank you so much for joining us today.
Hey, Jason, I'm wondering if your brain is having a few changes.
I'm very worried,
Don't
Teepa.
worry.
That's
We
always
can evaluate
happening.
him after the episode.
A little word finding, maybe some caffeine might help.
I'll take anything I can get at this point.
Teepa, we are so excited to have you on the show today. For those that don't know, Teepa is one of the world's leading advocates and educators for anyone living with dementia or other forms of brain change, and has more than 40 years of very clinical and academic experience in this field. She's been featured on NPR, PBS, Home Healthcare News, and many more. I know many of our listeners know a little bit about you or are very familiar with your work, but for those who don't, can you share a little bit about yourself, Teepa, and your background, how you got started in dementia care?
Yeah, well, I got started when my grandfather moved in and I was a kid, and somebody was better at helping him than my mom was, and that was just family. And then it became something I was curious about, and I worked in developmental disabilities as a teenager, and then finally got into geriatrics when I went to college and did some work as a nursing assistant to earn money and sort of pay for things. And then finally I went into occupational therapy and have taught and practiced across the spectrum. So, done a whole lot of different things and really focused in on brains and what happens when people's brains are different or changing and how to help folks.
That's wonderful. So before we dive into our content today, which is all things dementia, I know I'll reference a few things during the show about your new book coming out, Understanding the Changing Brain, which I've had the pleasure of reading over the last few weeks, and it's really a game changer for care partners and anyone wanting to really understand the why behind dementia, and also looking for tips as a caregiver or a care partner, which we'll get to later. This is the first in your series, Teepa. Can you talk to us briefly about your book and where people can find it and what's next for the series?
Yeah, so it's located in a couple places. We have it on our website for sale, but it's also available on Amazon, and we're making it available in different ways, e-reader as well as, print copy. And the goal of it was to take what we know about brains that change when they develop something like dementia, and then as well as helping people understand what people are having trouble doing, but appreciating what they're still able to do, which sometimes comes across as, whoa, what is going on here? And so understanding, that's what's going on here, could help us come up with new ways of engaging, of interacting, of accepting, and of changing our own brain and our own behavior so that we get better outcomes, which is what we're essentially trying to do, and keep a relationship going.
Mm-hmm. So, Teepa, let's start diving into our topic today. So we know that Alzheimer's has for many years been used as kind of a catch-all term for dementia types. I hear people use it all the time, Alzheimer's, dementia, interchangeably. So is that true? Are Alzheimer's and dementia interchangeable terms?
That would be a false. That is not true at all. So Alzheimer's is this particular form, cause, type of a dementing illness. Now, dementia means your brain has chemical changes, and then it starts to have structural changes in at least two different areas of function, and we can't fix it. We haven't figured out what's causing it, and we can't resolve it. So it's something that once it starts, the cascade of events starts, and it becomes caused by a variety of things, maybe different proteins, maybe blood flow in the brain or blood chemistry in the brain. But once it starts, this particular thing called dementia, it's not fixable. So we're going to have to figure out how to cope with it. but there's well over 120 different forms, causes, and types of dementia that we now know about.
So you mentioned different types of dementia. How many types of dementia are there? And are there similarities between the different dementia types?
Yeah, and so we know that there are categories, and then under the categories there are specific causes or types or things that we tend to put in a group. So under Alzheimer's, for instance, it's not all the same thing, although it's all related to beta amyloid plaque formation, abnormal pathology of protein, and tau pathologies, another protein. That combo means you have an Alzheimer's-related dementia. However, you could have a gene code that means that it's a dominant gene, and if one of your parents had it and you get that gene, you will develop Alzheimer's at a young age. It's called presenile. And then there are other ones that you have risk factors for it, like APOE. It's another gene, but you have to be exposed in certain ways. And your risk goes up if you have both parents with a certain, what's called an allele. And then if you have Down syndrome. So, under Alzheimer's, it's not one size fits all even. Mm-hmm. What we do know is under Alzheimer's, you will have, the signature is it starts in the memory center, the ability to hold on to new detailed information, and spreads into your decision-making center and your language formulation center, and your and then it spreads into your vision center, and finally it'll move into your movement skill center. But with things like Lewy body disease, which is a grouping, or frontal temporal dementias, which is another grouping, or vascular dementias, those are three big categories of dementia. And then we have some more specific over to the side, like chronic traumatic encephalopathy, which has come up a lot with football head injuries, or cheerleader head injuries, younger people having head injuries and then developing a dementia secondary, or people who have things like, let's say, epilepsy. It's turning out that people who have hard-to-control epilepsy might be more at risk for developing a dementia as they age. And then we have juvenile dementia. So I'll pause because it's like, I just garden hosed you right there.
You're fine.
Sorry.
Well, that was one of our questions too, and something I've always been kind of curious about too, because I think a lot of people assume when they hear dementia or Alzheimer's, they think, oh, that happens in old age. And you mentioned too, juvenile dementia. So does the onset of some of these different dementias vary in age ranges?
Perfect, yeah. As a matter of fact, the most common type of dementia for people under the age of 65 is frontal temporal dementias, not Alzheimer's. Although there are young onset Alzheimer's categories, the most common is actually frontal temporal type dementias, where vascular can go across an age range. And the juvenile dementias often are genetically related, and they can happen in utero, in infancy, in childhood, or in adolescence. And and there's even a dementia associated with multiple sclerosis. So, it's this tricky thing where you can have brain failure starting to develop for a variety of reasons, and it's important to note it can be at any point in time, although increasing age increases risk.
Wow. So a lot of these symptoms and signs of dementia that you've been talking about all seem to come from our five senses and how we process things. One thing you mention in the book is the importance of observing a person living with dementia as a first step in partnering in their care. Can you expand on that?
Yeah. So if I'm watching someone and I notice that they're taking their dominant hand, the hand they usually do things, and they're actually reaching out and tapping or patting on surfaces and picking things up and examining them. And that's not how they used to, engage with objects. What that says to me is they're having to actually use their hand to possibly compensate for some visual issues. And then even when they look at the object, they're having to consider, what is it I do? Oh, yeah. And so you can watch them go out and pick up a pepper shaker and look at it, and then you can watch them to see if, they go, and they start shaking it on the item on the plate, or they look at it and they turn it upside down, and it's like, whoa, wait a minute. So I can learn a lot about a person's abilities by observing before I start interacting, because what they see and what they do with what they see, what they're doing when I'm not present, can be really helpful for me to understand what might be changing for them.
Yeah, that level of observation seems to be key. We're speaking with Teepa Snow, founder of Positive Approach to Care, and we're going to continue our conversation on dementia right after this. Stick around. You're listening to Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5, AM 680, WPTF News, Talk, Traffic.
This is Aging Matters, care and comfort that surrounds you on FM 98.5 AM 680 WPTF with your hosts, Mary Lucas and Jason Kong.
Welcome back to Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5 AM 680 WPTF News, Talk, Traffic. Jason Kong here with Mary Lucas and Sam Peterson. Don't forget, if you want to learn more about Transitions Life Care, you can go online to transitionslifecare.org. Transitionslifecare.org. We are on the line here with Teepa Snow, founder of Positive Approach to Care. We're having a conversation about dementia as well as Alzheimer's, and Teepa has a book coming out called Understanding the Changing Brain, and she's helping us understand that changing brain as we were just mentioning some observations that can help us maybe be more aware of some changes that may be going on. But I'm sure we're going to get into more of those as well.
We are. We were, Teepa, we were just talking about some signs and symptoms to look for. And one of those things we wanted to talk about is communication. So this is one of the biggest topics that comes up for care partners who are helping someone with dementia or neurodegeneration. First, a lot of times people will see, and I hear about it all the time, especially out here in North Carolina with all our sweet Southern Baptists, the bad language and aggressive behaviors that can be really unusual for someone. Where do those symptoms originate from? What kinds of dementia? And what is this typically associated with?
Yeah, so what's really interesting about human beings is as we learn to interact with the world around us, it includes interacting with other human beings, but it also really means I have needs and I want to get my needs met. And one of the reasons we communicate is to get our needs met. But the other reason we communicate is with a reaction to something. So something surprises me and it's, oh, geez. There's that pause where I don't have a lot of words in that moment, because when you get surprised, another part of your brain becomes very active in going into threat perception mode. Is this threatening? Is this dangerous? Is this something to be curious about? Is this something that's helpful or risky or whatever? And it's called your amygdala. So it's a primitive part of your brain, and it shuts off your thinking and your talking and gets you to really look at something and then be ready for action, either flight, fight, hide, seek, or. And so when we talk about fight, what are some ways that human beings fight? So if I say, I never said that, and you wanted to fight with me or do it, what would you do back?
Yes, you did.
You sure did.
I did not. I never did. Why are you saying that? Now, this is called an argument, and an argument is a fight with words. So if I am going to have my emergency brain turn on, I don't want to lose my ability to argue, because that's a fight.
Same.
And it's like, I don't want to talk about this right now. Leave it alone, which is a flight behavior. Or I never said that could also be a hide behavior. Or, listen, I need something. Help me. Please help me. Now, what would you say if I said, please help me?
What do you need?
Yeah, what can I do for you?
What can I do? Yeah.
I need the, I don't know. Never mind. You are such a pain in the, and there goes the word. Because what did I seek from you?
assistance, and we couldn't, we weren't able to provide
And
it
you
right.
guys said, well, what do you need? And you asked me for the thing I can't give you because my brain isn't working well with language. And then I think you're chasing me and trying to trick me and trap me. And so then I never mind. But then I'm angry because I thought I could trust you. I thought you would help me. And all you did is push back at me. And so then I give you, and here's the other thing that gets stored in that emergency brain are forbidden words, because they reduce your cortisol level and they also allow you to push back or fight or let somebody know you don't like it. And so you know lots of words, but you never use them unless you're really upset. And so what we want to pick up on is, wow, their emergency brain went into overdrive, and I was just trying to help. And so basically saying, wow, Teepa, you need something. Rather than give me new words, pick up on the words I gave you. So that's what you do first. So I go, hey, listen, I need something. You would say, hey, Teepa, you need something? Question mark.
Oh, that's
And then you
interesting.
say, do you need me to do something, or do you want to talk to me about something?
Wow.
Give me an either-or option. So now it's not I have to come up with anything, because who gave me two sets of words to look at?
Right. So then you're not fighting that response. You're then replying,
Exactly.
and you're working together on getting that response.
Yeah. So you acknowledge, wow, she's having trouble finding words right now. So do you need something? An automatic social back is, what do you need? But if you're starting to notice I'm struggling with language already, then maybe the best I could give you then was, I need something. And the word that I would put there, I need a cup of coffee, I need to go to the doctor, I need help with my taxes, I need you to talk to my husband. You know, whatever it is, I couldn't find all those words because I felt threatened.
Right.
That's a great point. So are the repetitive behaviors or language, is that the same area of the brain when people start repeating things over and over again?
Yeah, that's a combination of the deep memory part of the brain called the hippocampal area, which is deep inside your brain where you learn and remember things, and you also know how to find your way and keep up with the passage of time. All those are there. So I'm having a problem there, and I'm also then having problems with, I want to be connected to people and I want to have a conversation, but I get caught in loops of conversation. And what I can't do is hold on to the details of what you say. So I want to know something. What time is my doctor's appointment? And you say,
Is that
2
10?
o'clock.
Yeah, 2 o'clock. Yeah.
Oh, today?
Yes, today.
Well, I wish you'd said something. And this is where
Yeah.
now whose brain goes into threat mode right there?
Right. I remember
tell
these
you,
moments
you
with my
have to-
grandmother. I remember these moments. It's all coming back. My grandmother had Alzheimer's, and I remember these moments. And she would get really angry because she felt like she didn't know, even though we had told her multiple times. Yeah.
Yeah, so what your brain noticed was that she would get caught in loops. What it was missing was, every time she goes to store that memory, there's no file cabinet anymore where she can put it.
Ah.
And she's a detail lady, so she likes the detail. So
Exactly.
how many of you tried
Detail.
writing a note for her?
Right. And you know, she was an English teacher, and we go back and look at her book. We go back and look at her books that were on her shelves, and she had notes in all of her books.
Yep.
She had written little things in every single book, and I have them saved because I found it was very interesting to go back and look at them and see how her brain was working and read her notes.
Yeah.
But there was notes everywhere.
Absolutely, because she was trying to hold on to what she couldn't hold on to. And she was using compensatory strategies. But when in the moment, she couldn't remember that she'd written it down any more than she could remember you said 2 o'clock. And so that ability to go, oh, you want to know what time your appointment is? Yeah, it's at 2. Hey, Grandma, I have a big favor to ask of you.
Yeah, what is
Now,
it?
what's the
Yeah.
automatic answer to that? What do you say when I say that?
What do you need?
Yeah, come here, let me show you something. I could take you to a book and say, tell me about this book. And all of a sudden, guess what happened to the doctor's appointment and the need to know the detail about the doctor's appointment?
It came back.
Yeah. It's not what's right in front of you. So right now, and if you again say, now, do I have a doctor? You do. But right now, could you do me a big favor? It's not till later.
Yeah.
What time? It's at 2, but, and we move it on because I have to watch my own brain as much as I pay attention to yours and know when I've reached my limit and know when I need help.
Right. So one other sign or symptom I want to touch on briefly, and we hear a lot about it in our practice in hospice and palliative care, is care partners who are concerned about their loved one who has stopped eating or drinking. Can you talk about the responsibility as a care partner in this situation?
Yeah, it is important to know whether or not it's time to let go of nourishment and hydration because, frankly, the brain's ability to take in and make use of that has already deteriorated. Or its ability to do it safely is really just not there. And the person truly is not hungry, nor are they thirsty, because those are things that are managed by the brain. And if the brain is getting to the place where it's saying, you know what, I want to clean up house because I can't live here anymore. I've done what I can do for as long as I can do it. And what I'm going to do is make use of all the resources. And so often, if you've noticed that the person has done a lot of muscle wasting, even though you've been trying really hard to get those supplemental things in and you've been working hard to get a sip and a drink, the recognition that the brain is no longer able to run everything, but it's got a safety mechanism where it releases endorphins as the brain is drying out and emptying out. And the person truly is satisfied with sips or with tastes and smells and textures. And their brain is often telling them, you're not hungry, you're not thirsty. Who would be hungry or thirsty if they didn't eat or drink? Us.
Yeah, right.
So we have a really difficult time letting go of our perspective to hear, well, their brain and our brain haven't been the same for a long time. And they're getting to that place where the brain can't keep going. And so starting to recognize the signals and the signs that that's happening, whether we've had a couple aspiration pneumonias, some urinary tract repeated infections, because the brain can't fight infections, it can't temperature regulate. Starting to recognize that need to prepare ourselves for that final release is really important because we have power to make this different. But we have to be able to accept it is a process that we go through as much as they go through.
Right.
That is the voice of Teepa Snow, founder of Positive Approach to Care, and you can understand why we've been looking forward to this conversation with Teepa. She has such a brilliant way of putting this in a relatable and easy way to understand. We're going to continue our conversation with her. We're speaking about elements of her book, Understanding the Changing Brain, and you can find more information about that either on Amazon or at teepasnow.com. Teepa spelled Teeepa Snow.com. teepasnow.com is the website to go to if you want to find more information about her book, Understanding the Changing Brain. Taking a quick break, we'll be back with more. This is Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5, AM 680, WPTF. News, talk, traffic.
This is Aging Matters, care and comfort that surrounds you on FM 98.5, AM 680, WPTF. 60 minutes devoted to giving you all the information you need when caring for a loved one. With Mary Lucas and Jason Kong. If you have questions for the show, you can email agingmatters@transitionslifecare.org.
This is Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5, AM 680, WPTF. News, talk, traffic. Jason Kong here with Mary Lucas and Sam Peterson. Our guest on the line is Teepa Snow, founder of Positive Approach to Care. She has a book out called Understanding the Changing Brain, and we're knee-deep into this conversation, and Mary, I know the past few weeks we've been talking, you haven't been able to put this book down. So it's very nice that we have Teepa on the line here with us.
Definitely. I'm excited to talk to Teepa more.
Yeah, and Teepa, in your book, you touch a bit on delirium, depression, and dementia. And I think this is really relevant in today's world, we're living in. We talk, as much as we don't want to, we talk about on the show about this pandemic we've been in and that it's been so challenging for many. And a lot of people, have been experiencing depression and other side effects of that. So how can you tell if it's dementia versus depression versus delirium, especially during everything that's going on with social isolation?
Everything that's going on.
Yeah, and having some really serious impacts on mental health for folks.
Yeah, and I think it's why would we be worried about it? Well, because it is important to notice. So if you were to get your thumb, your index finger, and your middle finger out, so those three fingers, which are the fingers of skill on a human hand. So if you've got your thumb, your index, and your middle finger out, you bring them together at the tips. That makes your hand skillful. So you can button buttons, zip zippers, that kind of stuff. Now close your index finger and your middle finger down so you have a fist with your thumb up. And I want you to take your thumb down and then pop it up real quick. Delirium pops up real quick. And with delirium, if you can't figure out what's going on, take your thumb and point it down, you could lose somebody. Because delirium is an acute, traumatic, dramatic change in someone that happens very quickly. And so it could be due to an inflammation, an infection, dehydration. It could be due to something acute and traumatic, dramatic. They could have a fracture that's unidentified. They could have organ failure. They could have a new health condition. So it really should, if you take your thumb and put it out and do that artist thing, it's like you want to focus in. If you notice something, wow, what is going on here? And you may see some symptoms like an unusual case of seeing things that aren't there, saying things that don't make sense, being hyper aroused or unable to arouse somebody that's usually alert and awake, and you can't get them to wake up and pay attention and participate. So you're noticing a huge shift in alertness and arousal, and it happened pretty quick. Now, if it has been happening over time episodically, that's a different story because that could be Lewy body dementia because Lewy body has a hallmark of having episodes of delirium and hallucinations. And that's just part of that disease. So I want to know this popping up. Now, touch your thumb to your middle finger. Now, if you're by yourself, you can hold your middle finger up, but generally I don't recommend it if you're around others because people think bad things. And that's when dementia pops up. And dementia is what nobody wants to talk about, nobody wants to look at, nobody wants to pay attention to. But it turns out delirium and dementia have lots of connecting places. Because delirium and dementia, when you show a delirium, we want to always look and make sure, is there a dementia behind that? Or if somebody has dementia, we may miss a delirium. And that's what happened with a lot of COVID cases with people who had dementia. We missed their onset of delirium and oxygen deprivation and changes until it was too late to start support to help them. And sometimes with dementia, the delirium is caused by the care partner not being available and somebody different or changing a location or, a new medication. So it's important to know what's the baseline and what's the new.
Right.
And depression or anxiety, take your index finger and point it up and then drop it down. Point it up and drop it down. That's an anxiety and depression combo. So anxiety and depression usually takes time to develop, but then it can spike and peak pretty quick. So COVID is a great example of I'm fearful, I'm worried, I'm scared, my primitive brain is turned on. So I get, what do I get when I'm fearful and scared and worried and my primitive brain turns on? What descriptor would you use for me?
Stressed or distressed or anxious.
Stressed or anxious. Yeah, so I develop anxiety. But if I already had an anxiety disorder, it means the chemistry in my brain is really turbulent. And so it increases my risk of dementia, but it also could send me into a delirium state with very little because once I get really anxious and then I get scared, I'm afraid somebody's going to try to poison me. So what won't I do? if I'm scared somebody would try to poison me because I'm anxious about stuff.
I'm not
and people
eating.
having
I'm
taking
not
anything.
drinking.
I won't
I'm
eat,
not
I won't
eating.
drink.
I'm not going anywhere.
So what happens? What happens to my risk of delirium?
It probably increases dramatically. Yeah.
Oh, there you go.
Yeah.
Yeah. So noticing that, and then on the other side, what's the point? Why bother? There's nothing worth living for anyway.
Right.
Nothing's going to get better. Nobody comes over. Why bother? I don't care anymore. I'm not hungry. I'm not thirsty. Just leave me alone. Get these kids out of here. They're too loud. Whoa. So take your index finger and put it right beside your middle finger. And what I'd say is about half of everybody who gets dementia will develop anxiety or more. About half of everybody who gets dementia will develop depression. And some people have both.
Wow.
Yeah.
So you can have, you're saying some things that have triggered with me. I had a conversation with my dad yesterday about my grandfather who does not have dementia. He is 96 now and he is doing very well, but he's had a lot of brain trauma. He had an aneurysm. He's had multiple strokes. He has a lot of chronic illness that he's been dealing with. And so he's gotten very stressed out. His caregiver situation over the last couple of weeks has been a little bit up and down, and we're trying to make sure we can level that out. But we've had different caregivers in there. And just this weekend, he started to get very delirious now that you're explaining it. And my dad was like, maybe he's got dementia now. And I'm like, I don't know. I think he's stressed. I think it's stress.
Yeah, exactly. And so maybe he's getting dehydrated. He's getting malnourished because now he doesn't feel comfortable eating. His stomach's upset. He's not sleeping well. So sleep deprivation. I mean, so these things all interact. And so now you have rather than make an assumption about dementia, you want to check this out because, this could tip over into a significant problem in that thumb direction. We can cause things where he could have another stroke. He could have something else happen that, we don't want to happen. And we need to get the other thing under control quickly.
That's so true.
Good example.
Yeah, and that's actually, you touched on another thing just there, in part of the whole caregiver switch around, his phone broke and it actually didn't break. He put himself on mute and couldn't figure out how to get himself off mute, but he thought his phone was broken. And so he couldn't call down to get food delivered to him from the cafeteria. He lives in assisted living. And so then he went without food until my dad noticed that he wasn't answering his phone and went over there, and he was sitting in his chair, hungry and probably dehydrated and all of these things. Yep. Wow. And this all
angry and scared and frustrated. And in that state, his brain was not going to allow him to know it was, and then he feels really stupid because it's like, I put it on mute. Oh my God, how dumb am I? And then you feel embarrassed on top of everything else. If we're not careful, it's like, so your phone isn't working. Well, that's frustrating. Yeah, that's crazy. Well, first, let's get you something to eat and drink, and let's see if we can figure this out. But what we tend to do, and I just a gasp. Your dad said, Dad, you just have it on mute. It's not broken.
Yes. Yeah, exactly.
Well, it's just trying to help. But when we try to help and we don't appreciate the other person's, nobody likes being stupid on top of everything else. No. And he really wasn't being stupid. What was happening, he was getting overwhelmed. We knew about his anxiety and his depression. We knew about, his health conditions. But it's easy to, when someone's older, it gets so easy to go, you just missed details. And it's like, I sure did. You could feel okay about that if you're not. And recognize what's the important thing. Well, let's get him hydrated and nourished first. And let's see if we can figure out what triggered this. And it's like, a little minor mistake, but then his brain wasn't able to figure it out because it was overwhelmed with his unmet needs.
So you're touching a little bit here on the treatment for some of these things. Which of these are treatable and how are they treatable?
Yeah, so it gets a little tricky, once again, when you have all three, because people living with dementia as their disease progresses will probably have episodes of delirium. And a frequent example is urinary tract infection. But what we have found is if we just keep treating the urinary tract infection, what we're missing is it's being caused by, let's see if you guys were really able to think when I was doing that earlier session at the end of life and eating. What do you think those episodes of urinary tract infections might be actually triggered by? What do you think? Could it be brain failure?
Maybe
Oh,
stress or some biological reaction, or I'm not sure.
yeah, it could be. Yeah, it could be the physiology of the body not being well supported by the brain. So the brain, believe it or not, has to recognize an infection and mount a resistance to the infection, which is the T cells and the activation of the white cell count and stuff. And so what happens is, as your brain is entering the later state of a dementia, your brain can't always recognize and fight infections. So what's the signal that my brain is getting into the later stage? What do I have more of? Episodes of
Confusion,
delirium.
anxiety, and delirium, yeah.
Confusion, yeah. So it becomes this, if we just keep giving antibiotics to treat the infection and we don't back up and go, okay, this is the upper respiratory infection in 4 months. This is the 5th UTI. She keeps repeating getting into dehydration. Maybe it's time we start having more broad conversations about this combination of things. What does she still find joy in doing? What is she still enjoying about being alive? How hard is it for her to be alive? Is it time for us to start thinking of comfort and support versus fixes? And it's hard conversations, but for me, that's what makes the difference between life that is valued and has purpose and has meaning to the very last breath versus we just keep putting Band-Aids on things that are much bigger than a Band-Aid problem.
Yeah, and it's especially hard when you just keep going along to take a step back and have that 1,000-mile view sort of perspective, that overhead perspective of things. So we're speaking with Teepa Snow, founder of Positive Approach to Care, and we're talking about different types of dementia and their unique warning signs, and we're going to continue our conversation right after this. You're listening to Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5, AM 680, WPTF. News, talk, traffic.
This is Aging Matters, care and comfort that surrounds you on FM 98.5 AM 680 WPTF. Joined by Mary Lucas from Transitions Life Care. Here's your host, Jason Kong.
You're listening to Aging Matters, care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care on FM 98.5 AM 680 WPTF. News, talk, traffic. Jason Kong here with Mary Lucas and Sam Peterson, our guest on the line. We're very lucky to have another segment here with Teepa Snow, founder of Positive Approach to Care, and we're discussing different types of dementia and what their unique warning signs are. And we've talked a lot about those warning signs, and now we want to get into a little bit of a discussion here on support. And I know we've got a lot to get to because this is our last segment here, so let's get right to it.
Right. We always use the word caregiver, and I hear that word over and over and over again, especially in our industry. But I've been shifting my language after reading your book, Teepa, Understanding the Changing Brain. And can you talk to us about the difference between care partners and caregivers?
Yeah. So if I am a giver, then you have to be the receiver. If we're partners, we're in this together. And unfortunately, we've gotten into this habit of thinking that, well, I give care and you get the care. And it's like, well, but I don't need the care. And right away, what are we going to start?
A fight.
An argument, a fight, yeah. And we'll call out all those things we don't want to call out. So say, hey, Mom, could you help me? I could use your help on something. I'm wondering about, I know you have an appointment at some point coming up. I think it's at 2. Did you want to leave these clothes on, or did you want to switch out?
Yep, that's a part.
So what I've done is given you an option, a choice. So I've delivered some information, but I really want you to partner with me. And I actually said, could you help me? Or I have a big favor to ask of you. Or, hey, Mom, I want to show you something. Rather than, Mom, those clothes look, you've been in that same outfit for 2 days. Mom, let me change you. Let me get you some new clothes. It's like, whoa. That, I think we forget sometimes people want to be in control of their own lives. And when my brain is failing me, it doesn't mean I suddenly just want, oh, here, do this for me, and I'll just sit here. Like, what am I going to do then? Some people will let you do that. I'll say, I don't feel comfortable driving. Here, take the keys. And it's like, what?
Yeah,
wait, you're going to quit driving? Yeah, I'm fine not driving. You'll take me places, right?
Mm-hmm.
Can you feel yourself just going, wait a minute, what?
Right.
You weren't expecting me to be so amenable. So it's tricky because sometimes we can turn into caregivers because I'm fine with you giving me care,
Right.
as opposed to I don't want care. But in both cases, it's better to partner with someone because they need value in staying alive and being alive and in relationships in order to thrive. If we don't have purpose and value and pleasure in being alive and joy in relationships, it's hard to want to stay alive and keep going and keep living. And that's possible, but it's hard work.
Absolutely.
Yeah, that's so true. And that's such a great way to think of it, a care partner versus a caregiver. And, you know, as you're talking about it, I think of my two grandmothers who could not be more different. One loves receiving all the care and help she can get. She was one of those that turned in her keys and said, you know what, I'm good. Y'all going to drive me around, right?
Yeah.
And the other one was definitely more stubborn in that aspect. So it's a great way to kind of look at those different types of care.
Yeah, and so the lady who gave up the keys, now this is where it gets a little tricky because how many of you went, so she wants to go to church, but then she wants to go out to eat, and then she wants to go visit so-and-so. I've got to get to work. I've got to.
Right?
Now what do you need?
You just described her schedule perfectly too, because that is her schedule. And, you know, for us, we were lucky that for that grandmother in particular, she lives very far away from us. She's in Maryland, in different states from myself and my parents. So that's kind of what we wanted to talk about next is support system. So for her, we were very fortunate that her sweet hairdresser volunteered to come help take her around, drive around. And I think it's great because it's a twofer. Your hair can be looking great and you get transported where you need. But we wanted to talk to you about support systems. So what kind of supports exist for people with neurodegeneration or dementia and their care partners and care supports that are focused on healthcare, but also community, kind of like I talked about a little bit.
Yeah, so when someone is going to have the brain changes that come with dementia, eventually their entire brain is going to be involved. So they're going to need social support. They're going to need some physical skill support. They're going to need some time management support. They're going to need some spiritual support. They're going to need financial and fiscal support. They're going to need community engagement support. They're going to need conversational support. So all of a sudden, it's like, whoa. Yeah, this gets to be a enormous job. And so anybody who's going to be the primary supporter and care partner is going to need resources and support. It's like this is not a one-person show. Two people alone, as the person's changing more and more and more, it really does start to feel like you're trying to run two lives in 24 hours. And that's a huge impossible challenge ultimately to do because you must take care of yourself or you'll have two people who are falling down and failing their brains because you can't be responsible for another human being 24/7. There has to be some boundaries for yourself, especially if spouse support or parental support or family support. So, creating these supports for people, it's work, but it's also important to figure out. I love that, the hairdresser, the relationship that was already a great one, became a bigger one. But also recognizing, but your hairdresser is not the one who's managing the finances.
Right.
I'm imagining.
No, definitely not. Yeah, we've had to.
And sometimes she's taking her places where she wants to be social. And so she's the transport person, but she isn't the person that your grandma socializes with when she gets somewhere.
Right. This reminds me of the quote, put your oxygen mask on first before helping the person next to you. Just great analogy. I have a crazy question for you. If you have one tip for a care partner once a diagnosis is established, what would it be?
Get help. It truly is. You're going to think at first, I can handle this. This is not that unfamiliar. I know this person. But if you can get yourself early on to pause, so pause, take a deep breath, blow it out, and go, I need help before I get so far into this that I'm out of gas at the side of a road on a deserted, scary place, and I'm trying to panic call somebody. And I can't even think of what's the number you dial when you're in an emergency, because in that moment, I'm so deep in the woods that I'm terrified. So there's no point in that. That's all cortisol. That's adrenaline. That's not a healthy thing in your brain. So really pausing and going, I think I need some help. I'll need to know stuff. I'll need to change my brain because her brain is changing. His brain is changing.
That's so true. And, you know, I know that's one of the big reasons we do this show. You know, if people go and listen back, we've got a lot of resources to offer for folks too, because we know that that's one of the biggest things as, you know, being a care partner, caregiver, is that you need resources.
It reminds me of the part.
You don't even know you don't. Sorry, go ahead.
No, it just reminds me of the part in your book where you talk about their selves and yourselves and the importance of knowing the self and the different selves that we have.
Yeah, because, I mean, we have commitments, and at one point, their life will be done, and their commitments to this world are finished. Guess what? You have other commitments, and if you've dropped everything, and now you're having to try to figure out, how do I get back? I don't even know where I am, because it's become 24/7, and the number of generations that have done that to their own detriment, it's time to go, whoa, let's build teams. Let's get this support in place. And the really frustrating thing is dementia is not a well-reimbursed condition for health care or social support. And so starting to make this something that isn't a taboo subject or something that's to hide in the closet, but rather, you know, a lot of us are going to have some brain changes that come with dementia. Let's learn about it so we can offer one another better support.
Definitely. And your book is a great example of that. So to finish out the show, can you tell us where people can get your book, when it's out, and where to go to learn more?
Yeah, it's currently available in hard copy, if you would. It's paperback, but, you know, that idea, at our website, you can go on and order it there, which is www.teepasnow.com. Or you can go on Amazon. It's available on Amazon. And we have an ebook version for those who like to do things on ebook. So that's should be available, I think really, really soon. I wish I were more sure, but I know it's really soon, if not now. But the hard print version is out.
Excellent. It's called Understanding the Changing Brain. She is Teepa Snow, founder of Positive Approach to Care. Teepa, you were incredibly generous with your time today. Thank you so much for joining us and for being a wonderful resource for our listeners today.
It has absolutely been a pleasure to work with you guys, and thank you for what you do every day and every broadcast, because it does help.
That's very kind of you to say. Again, the book is Understanding the Changing Brain. Learn more at teepasnow.com, or you can find it on Amazon as well. We are out of time for today. Thank you so much for joining us. We hope you will do the same again next weekend. On behalf of Mary Lucas and Sam Peterson, I am Jason Kong, thanking you for listening to Aging Matters. Care and comfort that surrounds you, a service of Transitions Life Care. It's your life, your care, on FM 98.5, AM 680, WPTF News, Talk, Traffic. Have a great day.
You've been listening to Aging Matters, care and comfort that surrounds you on FM 98.5, AM 680, WPTF. For more information, log on to transitionslifecare.org.